Dr. Enrico Karsten Hadde is going to present on texture aspects of special food for dysphagia patients. Enrico received his doctoral degree at UQ in chemical engineering, and his research interests center around the rheological and textural characterization of food and drink products for special consumers, such as the elderly or patients with dysphagia. So over to you, Enrico.
All right, thank you very much. So let me just share my screen. Right, everybody can see this now?
Yep.
All right. So thank you, Molly, for your introductions. So my name is Enrico Karsten Hadde. So as Molly pronounced it correctly, I just joined Uni SQs about 2 months ago. I think in September. Yeah, it's about 2 months ago. And so today I would like to introduce a little bit of what I've been doing for the throughout my career and research career, and this is some of the work that has covers some of my PhD and work that I've worked while I was in China. So it's a textural aspect of special food for dysphagia patients. So as you have heard, so my background is I'm working on a rheology of people who has rheology of thickened fluids or texture modified food for people who has a medical conditions called dysphagia, or it's So a little bit of my background. So I got my Bachelor of Engineering in Chemical Engineering in University of Queensland, and also my PhD in University of Queensland. So I'm a local Brisbane Queenslanders. And after I graduated in 2017, I moved to Zhejiang Gongshang University, that's in Hangzhou, working under supervisions of Professor Jian Chen. He's one of the initiator that introduced what dysphagia is, or swallowing difficulty in China. And from there, the topics is quite similar to what I've been doing in my PhD work. So it's a texture modification and characterization of food for elderly consumption, and also looking at the quantification and establishment of instrumental analysis methods for IDDS texture levels for dysphagia patients. So in 2020, the contract was supposed to until 2021, but as you all experienced, COVID hits in 2020. So I had to go back to Australia, to Brisbane in 2020. But I kept working on the projects while I was in Brisbane. So we had a collaborations with UQ professor, and then we managed to actually finish the project. And in 2021, I moved to Melbourne, working in University of Melbourne is industrial work with Bigger Cheese and Dairy Australia and Saputo Dairy Australia. So the project was looking at the high protein dairy products. So the goal was to develop or formulate a yogurt, a high protein yogurt. Basically, we want to up it to like 15%, 10 to 15% of protein, which in commercially right now is about 9-ish%. The highest Greek yogurt is available. So 2023, I moved back to Brisbane. And then that's where I am. So, sorry, not 2023, 2024. Sorry, 2024, beginning of 2024. I moved back to Brisbane. So, and that's where I am now. So, doing postdocs at University of Southern Queensland with Dr. Polly Bure. So, it is very exciting. Hold on a second. What? Okay. So to start with, I'll briefly explain. Most of you probably know what dysphagia is. So dysphagia is a medical condition for people who has difficulty in swallowing. So if you look at the video, sorry about the resolutions, it's kind of old video. So we have the fluid. So when we swallow fluid, in this case it's a fluid or bolus, we have the oral manipulations right here, and it started going to the the pharyngeal phase, and then it goes to the esophagus. This is the other valve is the trachea, where it goes to the respiration. So you want to go to the esophagus. But for people with dysphagia, there's a miscoordinations, or the valve doesn't close properly, sort of things, that there's actually a risk that the fluid goes to a trachea instead, which may goes to the lung for respiration system, and you may have aspiration or pneumonia. So because of that, people tend to, who has dysphagia, like they don't, they cough so many times when they swallow, and then they don't like swallowing, basically, which is essential for us, right? So when we eat, when we drink, and sort of things, and they may cause malnutrition and dehydration for them. And this is the symptoms of many diseases such as Alzheimer's, stroke, head and neck cancer. There's many symptoms or diseases that are associated with dysphagia, and it affects individuals of all ages, from infants to the elderly. But it's mainly due to elderly people due to the weakened reserves. So in Australia, we use the international standard. I think it's quite recent, maybe it's around 2013 or 2015, where we start adopting the International Dysphagia Diet Standardization Initiative, or short for, I call it IDDSI. So they develop a level standards for drinks or beverages, and for foods. So the drinks from level 0 to level 4, where it gets thicker and thicker as it goes a higher level. And for the food is actually is the reverse. So it goes softer or more pureed and sort of things as it goes low, as it lowers the level. So when it's like that. Like normally when we drink, we want to drink something thin like water, but we want to hit something solid like a steak, a dice of meat, or something like that. So it's and then they develop a testing method for the drinks, mainly for the drinks, is one that's called syringe flow test, usually used for level 0 to level they say level 3, but I would actually argue it's only to level 2, and a fork drip test for level 3 to level 4. And as for the texture modified food parts, it's they have the one testing method called spoon tilt test, where you actually tilt the spoon. You grab the sample, tilt the spoon, and see how it flows. And fork pressure test, where you press the food or the samples with the back of your fork. So after doing a lot of research, I don't want to bore you guys with a lot of details on the testing methods and stuff. So a little bit summary. So with foods and drinks classifications, I like to specify with the texture aspect of food for dysphagia. So there are two aspects, as mentioned. One, the drinks, what we call thickened fluids when we modify it, and the other one is texture modified food. So what really is the difference? Because sometimes they may actually, like if you look at here, level 3, level 4, or level 3, they both are in food and drinks, right? So what are the difference? Like, why do you call it texture modified foods, or why do you call it thickened fluids if they may actually have the same thickness consistency, for example? So really, mainly it's just a terminology, I guess. But with thickened fluid, normally it does not require chewing or mastication, and as like drinks, it can be swallowed directly. So because of that, it has a shorter time in oral cavity, and it mainly affects in the pharyngeal phase during swallowing. We stop the swallowing part there. Whereas for texture modified foods, most of it you require some chewing or mastication. So even the level 4 puree, you may not need it as much or as many chewing as the higher level, but requires a little bit, some of them, right? And sometimes because of that, it cannot be swallowed directly. And what's important is actually in the oral manipulations and the bolus formations in oral cavity, rather than when it's swallowing through the pharyngeal phase. So I guess that's the main difference between these two category, thickened fluids and texture modified food. Because I'm a rheologist, I like to think it as rheology parameters or rheologist perspective. So when we're looking at dealing with thickened fluids, I look at the rheological parameters. So from the thickened fluids, I divide it again into two different rheology deformations. One is the shear deformations and one is extensional deformation. Right, so I'll be explain what's both of these are. What's the difference between these two? So shear deformations, as you may have heard, like shear viscosity, shear thinning, yield stress, all of that terminology. Well, the extensional deformation is the extensional viscosity and or some, for food scientists, cohesiveness, probably the more the common term. Right. So before I start with the shear and extensional deformation, so I want to a bit explain why thickened fluid helps for people who has dysphagia. So thickened fluid slows down the swallowing process, increases pharyngeal transit time, therefore allowing better oral and pharyngeal coordination. So as I've mentioned before, because for people who has dysphagia, when we swallow, the valve close, the valve from to do the respiratory system close, and opens the one that goes through the esophagus. But for people who has dysphagia, they tend to move slower than the healthy people. So sometimes it's not closed properly, if you think about it. And then because it's not closed properly, some of the fluid or whatever, bolus, whatever sort of things may actually go through the respiratory system, which why we use thickened fluids. It kind of slows down the swallowing process, the flow, therefore giving more time for the valve to close. You can think a little bit like that, all right? Just the easy way to think of it. So that's why we use thickened fluids. It seems to be very effective and it works. And the other reason is because it's more cohesive. So because it's more cohesive, there's a less risk to fracture during multiple droplets. So therefore allowing the fluid to flow safely into the esophagus. And it does not require chewing or mastication. So therefore it's sure to stay in the oral cavity and can be swallowed directly, as I've mentioned before. So the shear deformation. So when we many years when we talk about thickened fluids, people tend to say, oh yeah, the thickness needs to be higher. It needs to be more thicker. It needs to be more thin, something like that. So, but essentially what they actually referring is the viscosity, shear viscosity, to be precise. So why shear viscosity? So shear viscosity is, if you look at the pictures here below, shear deformation is when you have the flow, the deformation is going between it's when it's the deformation is sheared, so it's like a friction, something like not really a friction, like like flow on the other direction. So as you can see from the pictures, right? So in the particle movement in a shear flow. So when we measure the deformations or the resistance of that flow, we measure the shear viscosity. So, and this is a very important parameter for thickened fluids, as many scientists already established, state that is for thickened fluids is one of the most important parameter. And this clearly shows that the slows down of the flow of the bolus in the pharynx is due to the shear viscosity. And we've also known that many thickened fluids have a shear thinning properties, which means that the viscosity is decreased as the shear rate is increased. And it has some of them has a yield stress, and it also affects the total amount of tongue pressure required to initiate flow of fluid for swallow reflection. So yeah, so it's what it means actually more like, it takes more effort to swallow thickened fluids than just a thin fluid like water, for example. Yeah, so the other part of deformations in rheology is what we call extensional deformation. So extensional deformation is, unlike shear deformation, is when material is deformed in an extensional flow. So if you look at the pictures here, maybe some more common term is when we stretched it, for example. So when we stretch a fluid or a material, we actually deform it extensionally, right? So the resistance of that, when we measure it, is what we call extensional viscosity. And this is less known for people or scientists in this area, because normally when we use rheometer, we use shear rheometer rather than extensional rheometer, this sort of thing. So sometimes people get confused the difference. Viscosity. When they say viscosity, they just assume it's shear viscosity, and it's probably the same as extensional viscosity. No, they are actually two completely different parameters. So extensional viscosity reduce the elongation of the bolus in the pharyngeal phase during swallowing. So just imagine that if I go back a little bit for this video, the swallowing video, you can see that from here that there's some stretching between the bolus. So if you have water or something that is a very low extensional viscosity, it can easily break. But when you have a high extensional viscosity fluid, that it forms as a bolus. It tends to form as a bolus rather than it breaks. So yeah, forward a little bit. Yeah. So another common sensory properties is what sometimes we call it cohesiveness. So this is by definition, cohesiveness is the strength of the internal bonds making up the body of the product. And this is a work that I did in one project that I did in China that shows two different types of fluids. So one has a high cohesiveness or extensional viscosity, and the other one has a low cohesiveness or extensional viscosity. And please do know that the shear viscosity of these two fluids is the same. So they have the same shear viscosity at 50 reciprocal seconds, but they have a very different extensional viscosity. Yeah, so I think one is a xanthan gum, the other one is starch. So you can actually see they behave very differently in syringe extrusion flow behavior. So it's just it's been extruded from the syringe, that's it. So that's one way to actually see cohesiveness of a fluid. Yeah. So moving on to texture modified foods part. So that was the thickened food. So that was a part of my work, of my PhD and work in China. So looking at the texture modified foods, we come up with another two category. One is what we call degree of structure, and the other one is called degree of lubrications. So I'll talk more details about this. So degree of structure is looking at the structure of the food. So the physical parameters, for example, like the particle size, food cohesiveness, firmness, adhesiveness, and all of that. While degree of lubrication is more looking at the, it's not a parameters, but is a different, not the structure, but looking at more the slipperiness of the food, the moisture content, and all of that, and which affects the texture modified foods. So before moving on here, so I'll explain a bit of what texture modified foods, right? So as I mentioned, texture modified foods is pretty much a food that we eat, but we modified it. How we modify it, it's depends on people who has dysphagia. So how severe their dysphagia, or whether they actually need level 6 or level 5, which is not too bad, or they need the one that's go to level 3 or 4. So how we modify it, it's depends on I guess how we modify it is the degree of the structure or the degree of lubrications of the food. So when you think about it, so there's a in 1988, sorry, Hutchings and Lilford come up with a food oral processing diagram. So they have this diagram where it's a 3-dimension axis, or one axis is degree of structure, the other one is degree of lubrications, the third one is the time. So this starting point, this black dot starting point there, imagine that's a certain degree of structure and lubrication of the food. So let's say, I don't know, a piece of steak, like a 1 cube of meat, beef, or something like a steak. It's still hard, it's still firm, and all of that, chewy and all of that, right? It has a certain degree of structure and a certain degree of lubrications. But over time, when we swallow it or masticate it, chew it, we decrease the degree of structure by chewing it, right? And at the same time, we produce saliva, which increase the moisture of the food. So the degree of lubrication increases, the degree of structure decreases over time, until at certain point where it goes to a swallowing bar, a hypothetical bar that was there, and we feel that this is safe enough to swallow, because we already form a bolus. We form a bolus from after we chew it and all of that. So this swallowing bar is what we ate when we eat, or when we chew food and stuff. Then we swallow it. So texture modified food compensates for chewing difficulties or fatigue. So by decreasing the degree of structure, so or increase degree of lubrications. So that's how we have a smaller particle size or less hard food, or we add more water. It tends to be easier for them to, like, when we have a puree consistency, for example, is more lubrications, right? So degree of structure basically measures the physical properties of the food during breakdown, like the hardness, cohesiveness, particles, as I've mentioned. And it tends to decrease over time during mastication. And there are certain or known parameters for degree of structure that is already developed by IDDSI. For example, that the particle size for people who has dysphagia, it should be approximately 2 to 4 meters. So, and this can easily be measured using a fork, like between the prongs of a fork. That's about 2 to 4 millimeters. And the cohesive, people who has dysphagia also recommended to have a cohesive meat or food, basically reduce the risk of oral residue, as I've mentioned before. And they, like, the adhesiveness or stickiness of the food should be avoided, like sticky food, because it prolongs the duration of the anterior activity during swallow and increase the risk of pharyngeal residue as well. And they also recommended to have a low hardness food, like something that is easy to chew and easy to chew and swallow, because they pressure the people who has dysphagia, they tongue pressure is much lower than healthy people, so they tend to get fatigue a lot. They chew more, they feel tired, and then when you're tired eating, that's just not enjoyable anymore, right? So it's recommended to have something that is easy to chew. And as I mentioned before, IDDSI come out with the spoon tilt measure, a split tilt test to measure the cohesiveness and adhesiveness and also firmness of the sample. And we use full pressure tests to measure the hardness of the sample. As for the degree of lubrication, so this refers to a physical phenomenon of friction reduction when a fluid functions as a lubricant between two interacting solid surfaces in relative movement. So in this case is between our palate and also our palate or tongue, basically in our oral, and with the food or the bolus, right? So this is associated with the moisture and juiciness. So like I like to use the word juiciness rather than fat because juiciness sounds more tasty, like oh it's good, like rather than oh it's so fat. Yeah. So yeah, so the more juicy meat, for example, helps the people who has dysphagia. So the degree of lubrications, kind of like the preliminary equation, you could say it, degree of lubrication is basically the initial moisture in the mouth plus the product's moisture plus the salivary flow rate because we produce saliva over time, and some other factors like like that I've mentioned, the fat concentrations, juiciness, and all of that, right? And it tends to increase over time during mastication because of the salivary flow rate. And so some of physical parameters for degree of lubrications is what we can measure is friction coefficient, for example, which determines the bolus flowability, and which we can actually use tribology to measure this, and also the moisture content of the food. And there's a research that says that we need approximately 50% of moisture content in the bolus to trigger swallowing. So anything less than 50%, we tend to keep chewing. Like even the degree of structure is ready. We don't have a degree. Like imagine when we eat biscuit, for example, right? Biscuit doesn't have a lot of moisture, but it becomes more and more as we produce saliva. Even though it's already crisp, like already ready to swallow, but if it's still dry, we don't want to swallow it, right? We still tend to wait until more moisture appropriate when we start to swallow it. Therefore, because of that, high initial moisture content food is recommended for people who has dysphagia. All right, so in summary, we have thickened fluids and texture modified foods. These both have different controlling rheological or textural properties for safe swallowing. The thickened fluids is looking into more rheology aspects between the shear viscosity and the shear deformations and extensional deformations, and they are more important in a pharyngeal phase rather than the oral phase. While texture modified foods is looking more into the textural properties, and they are more important in oral stage rather than pharyngeal stage. And as mentioned, important parameters for thickened fluids are generally related with the flow of bolus in pharyngeal stage, and it's known that shear viscosity slows down the flow of the bolus in the pharynx, and extensional viscosity helps to regulate bolus elongation in the pharyngeal phase. And for texture modified foods is divided into two categories, where we want to decrease the degree of structure by chewing and mastications, and at the same time we want to increase the degree of lubrications by adding more saliva, or some people drink it while chewing it, so that actually helps to swallow. Yeah. So just a little bit of closing out. Before I finish, I just want to share a little bit of what I'll be doing in UniSQ. So I just got my first project with the industry Kickstarter voucher with FABA. Of course, under supervision of Professor Polly, and we had an industry partner with Edible Cutlery. So the project is about repurposing food waste to formulate edible coffee flavored cups. So it's very exciting. So basically the idea was to use of coffee ground, which I may have emailed some of you guys in the office. Like if you use a coffee in the tea room, don't throw away the grounds because I want to keep it. Yeah, so the idea was using coffee grounds. So there will be some formulation development where we use some ingredients. We haven't really established what ingredients are, so I'm just putting some wheat flour and salt, but it may be different. We use some ingredient, we mixed it together, we develop a formula so we can have a batch of dough, and we can start doing functional testing, a lot of physical or mechanical testing parameters, like I'm not sure, like hardness, rheology definitely, and all of that. And the idea was to make an eatable cup or a cookie cup or something like that, which we can commercialize it. So that's the idea of the project. And yeah, so we hope to start early next year when all the administrations, documentations, all that. All right, thank you very much. Oh, and reuse it. You reuse the coffee grounds to make the cup again. All right, thank you very much. So